Okay, let's talk about something that can be incredibly annoying and persistent: excess mucus. Whether it's that constant feeling of needing to clear your throat, a stuffy nose that just won't quit, congestion deep in your chest, or maybe something more chronic like bronchitis or sinus issues, dealing with too much phlegm is no fun at all. It can mess with your breathing, your sleep, and just generally make you feel uncomfortable. So, the question comes up a lot: what can actually help with this respiratory mucus? Hey, real quick before we start, if you like this kind of info, make sure you're subscribed or following. It's just the easiest way to get all the new tips I share. We're talking about clearing things out from your lungs, your sinuses, your throat, wherever it seems to be setting up camp. Interestingly, one powerful ally in this battle might be something incredibly simple and fundamental: salt. Now, I don't necessarily mean just eating more salt, though electrolytes are important, but rather harnessing the power of salt in the air you breathe or using it directly for rinsing. The power of salt, halotherapy, and saline rinsing. Have you ever heard of halotherapy? It basically means salt therapy. There are devices called halo generators that do something pretty cool. They take microscopic salt particles, usually pharmaceutical grade sodium chloride, and disperse them into the air. The idea is you'd have one of these machines running, perhaps in your bedroom while you sleep, creating a sort of mini salt room environment. Why would breathing salty air help? Well, salt has a natural property called hygroscopy, which means it attracts water molecules. When these tiny salt particles land on the mucus lining your airways, sinuses, throat, lungs, they can help draw moisture into the mucus. Thick, sticky mucus is hard to clear, right? By making it more watery and less viscous, salt therapy aims to thin it out, making it easier for your body to cough up or expel naturally. Beyond just thinning mucus, salt also has some inherent antimicrobial properties. It's known to be antibacterial and antifungal. Think about how salt has been used for centuries to preserve food. It creates an environment where microbes struggle to survive. So, breathing in salty air might also help create a less hospitable environment for any unwanted bacteria or fungi that could be contributing to irritation and mucus production. Now, a full-blown halo generator might be an investment, but there are other ways to use salt: neti pots or sinus rinse bottles. These are probably the most well-known methods for sinus issues. You use a specially designed pot or bottle to gently flush a saline, saltwater solution through your nasal passages. This physically washes away mucus, allergens, dust, and irritants. It also moisturizes the nasal passages. The key here is safety. Always use distilled, sterile, or previously boiled and cooled water. Never use tap water directly, as it can contain harmful microorganisms. The saline concentration is also important. Usually, pre-mixed packets ensure the right balance so it doesn't sting. Many people find regular sinus rinsing incredibly effective for chronic sinus congestion and reducing mucus. Saline nasal sprays. These are a gentler option, readily available over the counter. They provide a mist of salt water to help moisturize dry nasal passages and loosen mild congestion. They're less about a full flush and more about gentle hydration and loosening. Salt lamps. While popular for their ambiance, the amount of salt particles released into the air by a typical Himalayan salt lamp is likely very minimal and probably not concentrated enough to have the same therapeutic effect as a halo generator or direct saline rinsing. They might offer some mood benefits, but don't bank on them alone for significant mucus reduction. So, exploring salt therapy, especially through direct saline rinsing for sinuses or potentially a halo generator for broader respiratory benefit, lungs, throat, is definitely something worth considering. It directly targets the mucus, aiming to make it thinner and easier to clear. Playing detective. Could your environment be the culprit? Before you dive deep into remedies, take a step back and consider your surroundings. One major, often overlooked trigger for chronic respiratory mucus is mold or mildew in your home or workplace. Mold releases microscopic spores and sometimes chemicals called mycotoxins into the air. When you breathe these in, they can cause allergic reactions or act as irritants, triggering inflammation in your airways. Your body's response to this inflammation, often it's to produce more mucus as a way to trap and expel the invaders. You might be surprised. Sometimes people suffer for years with chronic sinus issues, congestion, or coughs, try all sorts of treatments, and then discover a hidden mold problem behind a wall, under a sink, in the HVAC system, or around window seals. Common signs include a musty smell, visible discoloration, black, green, white fuzzy patches, or worsening symptoms when you spend time in a particular area. If you suspect mold, look carefully in damp areas, bathrooms, kitchens, basements, laundry rooms, around pipes. For small patches on non-porous surfaces, cleaning with appropriate solutions like vinegar or commercial mold removers following safety precautions might suffice. Use dehumidifiers in damp areas, fix leaks promptly, ensure good ventilation, especially in bathrooms after showering. If the mold problem is extensive, generally more than 10 square feet, or if it's inside walls or HVAC systems, professional mold remediation is usually necessary to address it safely and effectively. It's remarkable how sometimes simply changing your environment, maybe even noticing your symptoms improve when you're away from home on vacation, can be the biggest clue. Addressing an environmental trigger like mold could be the key to finally getting rid of that persistent mucus. Supporting your system from within, nutrition and lifestyle. Beyond direct therapies and environmental checks, what you put into your body and how you treat it also plays a role. Certain herbs have traditional reputations for supporting respiratory health and dealing with microbes that might be causing the mucus. Oregano oil, this is a potent one. Oregano oil contains compounds like carvacrol and thymol, which have strong antimicrobial, antibacterial, antifungal properties. If your mucus is related to a lingering infection, oregano oil might help combat the underlying microbes. It's quite strong, so it's usually used in diluted form or encapsulated, often for short periods. Garlic, a kitchen staple with a long history of medicinal use. Garlic contains allicin and other sulfur compounds known for their immune-boosting and antimicrobial effects. Incorporating fresh garlic regularly into your meals is an easy way to leverage its benefits. Olive leaf extract. If a viral component is suspected in your respiratory woes, olive leaf extract might be worth looking into. It contains oleuropein, a compound studied for its antiviral and anti-inflammatory properties. Drinking plenty of plain water throughout the day helps keep all your bodily fluids, including mucus, thinner and less sticky. Dehydration can make mucus thick and difficult to clear. Aim for consistent water intake. The power of fasting autophagy. This is a fascinating area. Fasting, particularly longer periods like 48 or even 72 hours, done safely and ideally with some guidance, especially initially, triggers a cellular process called autophagy. Think of autophagy as your body's internal housekeeping or recycling system. During a fast, when external energy isn't coming in, your cells start cleaning house, breaking down old, damaged proteins, dysfunctional cell parts, and even microbes like viruses and bacteria that might be hiding out. By cleaning up cellular debris and potentially reducing the load of pathogens, autophagy can help calm inflammation and improve overall immune function. A stronger, more efficient immune system is better equipped to handle whatever is triggering the excess mucus in the first place. Even regular intermittent fasting, like time-restricted eating, can promote some level of autophagy over time. Important note: longer fasts aren't for everyone. Consult your doctor before undertaking fasts longer than 24 hours, especially if you have underlying health conditions or are on medication. Steam inhalation, a classic, simple remedy. Breathing in warm, moist air can be very soothing for irritated airways and helps loosen thick mucus in both the sinuses and chest. You can do this simply by taking a hot shower or bath, or by carefully leaning over a bowl of hot, not boiling water, with a towel draped over your head to trap the steam. Adding a drop or two of eucalyptus oil, Use caution, it's potent, can enhance the decongestant effect for some, but be mindful if you have asthma or sensitivities. Dealing with persistent mucus often requires looking at things from multiple angles, using saline rinses or sprays to physically clear and thin mucus in the sinuses, considering halotherapy, salt air, for broader respiratory benefit, using steam to soothe and loosen, investigating and addressing potential triggers like mold or other allergens, irritants in your home or workplace, staying well hydrated, exploring supportive herbs like oregano, garlic, or olive leaf if infection is suspected, considering the potential benefits of fasting autophagy for deeper cellular cleanup and immune support with appropriate caution. Paying attention if certain foods, like dairy or excessive sugar processed foods, seem to worsen your mucus production. Most importantly, while these strategies can offer significant relief and support, remember that persistent or severe respiratory mucus warrants a visit to your doctor. It's crucial to get an accurate diagnosis to understand the underlying cause, whether it's an acute infection, chronic sinusitis, allergies, asthma, COPD, or something else. These natural approaches can be powerful complements to conventional treatment, but they shouldn't replace proper medical evaluation and care when needed. Finding what works best for you might take some experimentation, but by addressing potential environmental factors, using targeted remedies like salt and steam, and supporting your body from within, you stand a much better chance of breathing easier and saying goodbye to that frustrating excess mucus. If you found this helpful, give it a thumbs up and share it with a friend. Try it out and let me know what you think. Drop them in the comments and I'll do my best to answer. Don't forget to subscribe for more tips and tricks like this.